Good morning, everyone. Thank you for joining us today. A very warm welcome to everyone. And this overwhelming participation in the webinar shows a collective commitment to the children and their right to have a family. I believe we all have gathered here today with this shared understanding and notion that children should grow up in a loving and nurturing family environment and that holistically supports their development. I would like to welcome you all again. And for our first session, we have with us Mr. Senthil Kumar Gurunathan uh, to give a keynote speaker. He's a keynote speaker for this session. And Mr. Senthil Kumar is an executive director at Catholic Relief Service India. He has worked as an executive director with CRS and support the operations in India and Sri Lanka. Mr. Senthil has more than 20 years of experience in social research and programming, spanning humanitarian and long-term social development in diverse socio-cultural settings. We really we welcome you, sir, for this webinar, and we would request you to kindly give your keynote on for the webinar. Thank you so much, sir. Thank you.
So are you able to hear me well?
Yes, sir. Yeah.
Okay, thank you so much. A huge warm welcome to all the participants here. It's delighted to be amidst all of you. It's a pleasure to be actually sharing my thoughts with all of you. I'm hearing that there's overwhelming participation or interest in this topic, which is hugely encouraging. So huge thanks to each one of you for really making the time and being part of this conversation. I mean, we are all here together today because we all have a strong commitment and we are actually passionate about children and their lives and how we can actually bring about positive changes in their lives and contribute in our own way to the betterment and to better nourishment of their lives. And we all know about the harms of institutionalization. I think over several decades, there has been a strong uh, uh, tendency to actually have children housed in institutions with the consideration that that's going to be for their betterment. But then over the years, as we have been actually institutionalizing children, as they have been growing in childcare institutions, we have come to understand, and there is hard evidence which actually has come to point out that that's not necessarily the case. Being in the institutions is not necessarily helping the children, be it their physical or cognitive growth or their mental well-being. So there has been an evolving thinking in different parts of the globe as to how we can actually look at alternative approaches to institutionalization and what does it mean and how do we even look at moving children from the institutions to alternative care practices. And we all have been sort of working on different parts of it, and I know that there are several of you who have been working on this. So again, a huge warm welcome to actually sort of for this conversation, which is actually going to help us dive deeper into this. And particularly, I would like to call out to UNICEF, the India Alternative Care Network for this collaboration, where we are actually being able to bring together this topic for conversation. And I say it is for conversation because what we are here to actually listen to each other, share our thoughts and insights, and hopefully we will actually co-create what we call as our approach to transition. And as I said, the transition is assuming importance because of the idea to actually think beyond the institutions and the harms associated with that. And it's not that we are actually doing it for the first time. Probably there are a lot of us who are actually either as practitioners or as donors or academia who have actually been involved in this work in our own way. And we all recognize that there have been parts of this work which has been happening in different parts of the country as well. Possibly it's now time to actually sort of bring together those learnings and then see how we can actually move forward. And also to note that the policy environment in the country is also pointing to the fact that we need to look beyond institutions, and there is a strong intent to look beyond institutionalization. But then, how do we actually approach this? And I think that's the big question which we are actually going to uh, think about over these two-part webinar today and in the following days to actually grapple with this topic of this transitioning from the outside of the institutional care. And this is going to be a very big part of our conception of how we can reform the care sector. Not to say that we are actually moving away from the commitment to care, but that it's more about reconfiguring and possibly recalibrating our commitment to care so that it is actually going to do good to the children and keeping the children at the center of what we actually want to do. It's also a great platform because and we are actually thankful to the IACM for really sort of bringing us all together because it does give us a huge opportunity uh, to recognize what we are already doing, but then also understand what is out there beyond what we are actually doing in our individual manner. So many of our efforts at this point in time, however well intentioned and however good they are, and how positive and forward looking they are, there is a huge opportunity for those to be much more connected with each other, and then for each one of us to learn from each other. So it's going to be a great opportunity for us to actually come together and see and share our practices, but equally also learn from what's happening globally. And there are contexts where I believe there have been promising practices in terms of transition, where the concept has been further thought through, refined, where there have been several tools and processes which have been developed to support the transition from an institutional care to, say, family-based care or a community-based service where they support the families. So it's going to be interesting to learn from these global practices, both in terms of what has worked and what has not worked, and more importantly, how we can actually just not learn from these global practices, but then also look at adapting these and then contextualizing this to the country, given the diversity and given the other socioeconomic factors which we actually grapple with in our own context. So I think it's going to be a huge opportunity for us to look beyond our individual experiences, learn from each other, learn from the global experiences, and see how we can adapt and contextualize this. It's also going to be very important as we move forward in this effort to see how we can be better coordinated, not just because we want to be better in our work, but then also to actually keep in mind our central commitment, which is to the children and to the families in terms of how we can our coordinated efforts would really help the children and add more value to their lives and be offering much more uh, positive betterment to them in that sense. So I think the coordination is going to be important, and having this dialogue to start with, where we would like to unpack the concepts, understand what transition means, and how we have been relating to it so far in our own realm, and then also hearing how others have been sort of understanding this concept from their own experiences and their own contexts, and see how we can actually translate this knowledge, which I'm sure we will actually be having improved understanding on this from today's conversation. But then, how do we actually use some of this for our own actions, so that our actions can be informed about by this knowledge, and also how we can actually continue to stay engaged and coordinated, not just to actually act together, but then also to keep the learning journey going on so that we can exchange our thoughts and from our experiences and improve and refine the learning which we have on transition and add value to each other's work so that as practitioners, as donors, as as other stakeholders, we are better informed and we can actually do the work which we are currently doing in a much improved manner for the betterment of the children. So I guess that's broadly what this collaborative effort between UNICEF, CRS, and IACN is aimed at. I'm really happy that there is there's a great interest to actually sort of understand this concept and take it beyond that. So I also take this opportunity to thank all the team members who have actually sort of really put together this effort and worked untiringly to actually sort of bring this conversation to all of us. I'm really pleased that we are here and looking forward to actually hearing from other colleagues and learn from their experiences and see how we can actually take forward our commitment to learn and act on the transition. Thank you all for having me here.
Thank you so much, Mr. Senthil. You've really rightly said we not need to make ensure that transition happen, but it also happens smoothly and without any trauma to the child and the families. Thank you, sir. And now moving on to our next segment. So before we move to our next segment, I just wanted to make some announcement regarding the um, this has already been I think skipped. Make sure you introduce yourself in the chat with your name, with where are you from, and if you have any questions, please raise your hands. We will unmute you, and then you can ask the question directing to the speaker, or we'll ask you to share your questions. Also, there is a very important announcement that during your during whenever you're sharing any experience, please make sure that you do not mention any name, location, or reveal the identity of the children, so that we can maintain the confidentiality. So I hope we all agree to that point. All right. So moving to this is going to be the agenda. We have already looked into the keynote speaker, which was Mr. Senthil. And now to understand why we are having this webinar, what is the need for this webinar on the transition, we would like to just set the context for it. For the context setting, we have planned a few questions, and we will be sharing with you with on this screen some questions which we have planned, and I would request everyone to please participate because this will be there only for 30 seconds. So I would request Shweta if you can start sharing your screen. So on your screen right now, you will receive a message from a Mentimeter, and you just have to accept that so that you can answer it. So there will be a small dialog box. So you have to just join it and answer the questions. All right. So you have to join that, and you will see on your screen there will be a question, and on the chat box where or there would be a dialog box where you can select the answers. So before we go into what the transition is all about, it is important to understand why first we had to keep the children. So this first question is about why children are kept in residential care, and you can choose multiple options also.
Kavita, can you see the question?
Yeah, I can. Any participant also tell us if we are able to see the questions, because I can see the responses also.
Yes, we can.
Yes, it's
Yes.
working.
Okay. 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 Thank you, everyone. Please do participate in the question, because it's important that we have the understanding, a common understanding about why we are doing this, why we are changing or shifting from a residential care to the family based care. So I can see here there is a huge number of people believe that the children are kept in institution because of neglect, abuse, poverty, and education. And the highest number is poverty. So we have right now 103 participants, and the questions are and the responses are not 103. So I would request everyone to please quickly participate in the.
It looks like a few people are having difficulty. Maybe if we could just put the Mentimeter link in the chat. It should have been a pop-up. You should see a pop-up on your screen.
Yeah.
It says interact here.
So if you're joining from a phone, it might be possible that you may not be able to see this interactive dialog box. In that case, we would request you to please send your responses in the chat box. Or Shweta, can you post the link here? Yeah, Shweta has posted the link here. So a huge number of people, there's the highest number goes to the poverty. It's almost 20 people think that the poverty is the main reason why children are kept in institutions. Those who are not able to see, can you just go to the Mentimeter and place this code there, and then you will be able to respond. All right. So I think we will, we have to now move. I would request if those who are not able to get this dialog box, you can go to the Mentimeter account and then just write this code here, and then you will be able to participate. Okay. So we can see that there are 30 people who think that poverty is one of the major reason. In this poll it has come out, poverty is the major reason why children are kept in residential care. All right. Thank you everyone for participating, and apologies who could not. I would request to please go into the Mentimeter and add this code there, and so that you can participate. Can we move on to the next question? Yeah. So our next question is, what would you say is the best definition for term care reforms? Again, you can see a dialog box here and you can write your answer there. Those who are able to see the dialog box, can you please start responding? Yes, so we have got one response that says non-institutional care. Hmm. So we are receiving a lot of responses now. That's really wonderful. So we've received so far 24 responses and it's counting. You can scroll the screen to see all the responses. So we have received 28 responses. So a lot of people have mentioned that it's important to have the core of the best interest as the core of the children for any care reforms. And there has to be a balance between an institutional or non-institutional based care, keeping the best interest of the child in mind. Accordingly, is the best term for the care reforms. And there is one more definition which says a comprehensive approach involving family strengthening, community service, gatekeeping, family-based alternative care. That's really wonderful. I'm really happy to see such a lot of participation and enthusiasm. All right. Thank you, everyone. Thank you for thank you for participating. Okay, can we move to the next question, Shweta? Okay, so the next question for us is, how familiar are you with the concept of transitioning models of care? If you have heard about it, if you are practicing. Okay, so we have one response saying, I'm interested to learn. All right. More and improve our approach. All right. So for this, you can only choose one option. So a lot of people have responded that they are interested to learn a lot more about transitioning models of care so that they can put it into action. I think the highest number is there. So 18 people have responded to this option. Yeah. So we have got like 100 participants now. So I would request everyone to please keep answering. And who are not, those who are not able to see the dialogue box yet, please share your responses in the chat box. All right. So many people are interested to learn. I think this is where this is itself is demonstrated when people register for this webinar that they're very eager to learn and believe that it's important that the children should be with their families with a in a nurturing environment so that they can grow holistically. All right. Wonderful. Thank you, everyone. Thank you. Thank you for the responses. Okay, we'll very quickly move to the next question, Shweta. Thank you, Shweta. So when we talk about transition of care services, what comes to your mind? Wonderful. Children's best interest, family-based care, reorganizing. That's wonderful. Donors, organization. Wow, such a lot of responses within such a short span of time. So we have received 60 responses right now. Yes, so family-based care. All right. Thank you. Thank you, everyone. Thank you for the responses. I think family strengthening, family-based care, donors, family. These are the words that comes to your mind when we talk about transition of care services. Thank you, everyone. Shweta, can we move to the next question now? All right. So what do you expect to learn from today's webinar? Today's this we are going to have this webinar till 5:30. So what do you expect to learn from this webinar? Hmm. So we've been receiving responses saying emerging issues, transitioning models, in-depth understanding about transitioning models. All right. Practical solutions. Wonderful. To have a much deeper, clearer view and knowledge about transitioning models. Cross-learning of different practices. That's wonderful. All right. Practical knowledge. Okay. The processes and tools for fulfilling care reforms agenda. Like to learn the changing models of transition in an organization. All right. So this is very interesting. I really hope we would be able to, we'll try our best to cover these expectations. So we all know that it's important. We had for a very long time we had been seeing children facing trauma or abuse in institutions, and then it demanded a change in the shift, a change in the care reform, a shift in the care reforms. That's why now we are focusing more on the family-based alternative care and family-based care. But with that note also, we also need to be very mindful that the transition or the shift should not bring or re-victimize or re-traumatize the child, either the child or the family. So it's important that we it's important to establish a shared understanding of transition in terms of concept and processes to ensure a smooth and safe shift from institutional care to family based care. To facilitate, I think we can stop Shweta now. Thank you, everyone. Thank you, everyone. Really, thank you for participating in this quick, very quick surveys. Shweta, can you? You're the host. Okay, I just wanted to share something. So as I was just sharing, it's important that we focus on more on family based care, because we all have witnessing the trauma that children face, and no matter what the facilities are, the best of the facilities in the institution cannot fulfill the emotional, psychological, and social needs of a children. And besides, the most crucial part, the children are losing touch and the connect with their own families. And it is important that we have this understanding, a shared understanding of transition in terms of concept, in terms of processes. And to build that understanding today, we have with us Miss Beth Bradford, Senior Associate Mistral International. Welcome, Beth, and thank you for agreeing to be part of this webinar. Ms. Beth is a senior associate with Mistral International, International, and former technical director of Changing the Way We Care. She has 30 years of international child protection experience, including work with both government and non-government partners. Beth has focused her career on child protection and care system strengthening, integrated case management, social work practice, transition of care services, alternative care, and family strengthening. Thank you for joining us, Beth, today. With Beth, we also have Mr. Manoranjan with us today to facilitate this discussion. Mr. Manoranjan Das is currently working with CRS India as a technical associate for the Changing the Way We Care initiative. He has more than 20 years of experience in development sector. He's a keen interest on childcare reforms and working experience on case management, gatekeeping, family strengthening, alternative care, and transition of care services too. A very warm welcome, Mr. Manoranjan Das, and we're very happy to have you both here as a facilitator. So over to you, Beth and Manoranjan.
Thank you so much. It's really nice to be here, and I'm thrilled to see the level of interest that we have with so many people on the webinar today. So again, a big thank you for inviting me, and I'm happy to talk about the global perspective on transitioning models of care services, and also to begin the conversation on what that means in the context of India. We can go ahead to the next slide, please. Next slide. Oh, thank you. So just to frame our conversation today, the idea of transition is very much embedded in both international, but also your India national legal frameworks. So you can see on the screen, when we think about international frameworks, we're talking about first and foremost the UNCRC, the Convention on the Rights of the Child, and there very strongly highlighted the best interest of the child, family environments being important, the right of children to be brought up by parents when at all possible, the right to participation and to be able to participate in decision making according to the child's age and evolving capacity. And then, of course, there are also principles of necessity around alternative care, the mention of poverty not being a reason to separate a child. And that is very much reflected also in the international guidelines on the alternative care of children. As you all know very well, and certainly much better than me, when it comes to your India national legal framework, the National Child Policy from 2013, the Juvenile Justice Act, and then the newer Mission Vatsalya also reflects these same rights and these same principles. So when we're talking in depth in just a moment about transition, do keep in mind that the concepts, the ideas are really firmly embedded in the legal frameworks that you have in place. Perhaps a webinar for another time is to take a deeper dive into those legal frameworks. We can go to the next slide, please. So what I was tasked with was to talk a little bit about what transition is, what transition is not, how we define it. I'm always going to be speaking from the global perspective. We're going to hear from others today as well in terms of what this means in the India context, but just keep in mind what I'm presenting is from a global or international perspective. So when we talk about transition of care services, we really are talking about repurposing financial, infrastructure, human, material resources that currently go into residential care, types of residential care in India. But it's really not about closing childcare institutions quickly, right? It's about a careful and thoughtful process. Transition is about upskilling human resources to provide different kinds of services, community-based services. It's not about taking away jobs or creating new families at risk. Transition is very much about safely placing children in family care, often back to their families of origin, other times into quality family-based alternative care. It's not about doing that quickly or quickly exiting children. I think a lot of times I've seen institutions or residential care facilities that will reunify all the children, empty their space of children, and say we transitioned. Our change process is finished. It's not about doing that quickly without assessment, without plans, without preparation, and without monitoring children for safety and really permanent care and families. Transition is about a collaboration, about a planned process. It's not about making decisions for the staff, for the directors, for the founders or the donors, sometimes who are located outside of India. It's about working all together on a process of change. Sometimes it leads to closure and divestment, and other times it leads to a new and often exciting type of service that the organization can provide. Transition does not mean ending the support to children. Those children who are currently in childcare institutions need the organizations who support them to continue to support them even as they move to families. We can go to the next slide, please. Just to mention, please feel free to put any questions that are coming up for you in the chat. We do hope that we'll answer them by the end of the webinar today, but we will also come back to you if we can't. So as the questions are coming up, feel free to put those in. We have done a lot of work internationally. There are global working groups. There are people who have been working on different kinds of guidance. As we learn from transition of residential care facilities to community-based services, there has been an evolving effort internationally to capture that learning and to begin to pull it together into something that we can all use and have a common understanding around. So what I'm sharing now is the global definition of transition. Transition referring to the process of changing the model of care service provided by an organization. That could be a government organization or a non-government organization, from an institutional or residential model of care to family-based alternative care and or community-based family support services. Transition is an integral component of the child protection and care system reform. So you see care reform in that visual on the right-hand side. Transition has a strong intersection with your national child protection system and with policies in India, as well as childcare system reform and deinstitutionalization, which both recognize the right of every child to family care as an optimal environment for growth and development versus detrimental effects of institutional care. Transition and care reform are not one and the same. Care reform refers to the changes to all the systems and mechanisms that promote and strengthen the capacity of families and communities to care for their children. Address the care and protection needs of vulnerable or at-risk children to prevent separation, decrease reliance on residential care and promote reintegration, and then also ensure appropriate family-based alternative care options are available. So you can see that transition really sits within this idea of care reform, both around transitioning or transforming institutional care, but also in oftentimes changing to a model of family-based alternative care, or changing to services that really promote children to remain in families and prevent separation. We could go to the next slide. I'll just speak for a moment on some of the really important outcomes for around transition, and those are at an institutional and on a systems level. So on the one hand, we would expect to see the safe reintegration of children back to families and communities, that divestment of human, financial, and material resources from individual institutions. At the same time, reinvestment. We need the resources that come in India to provide care for children. We need those to continue to come in. So we need reinvestment in really family strengthening and family focused kinds of services. But at a larger systems level, we would also expect the transition process to result in fewer children in institutional care, in the existence of fewer number of childcare institutions, and really a more robust and scaled development of non-institutional services. I wonder if I might invite Manoranjan just for a moment to speak to the visual on the right-hand side of the slide, just in terms of some of the impetus for transition in the India context. Are you there, Manoranjan?
Yeah, thank you, Beth. Hope I'm audible.
Yes, you're
Yeah.
audible, Manoranjan ji, but can you please switch on your camera also, because we are not able to see you.
Yeah, my camera is switching. Probably there is some technical
All
problems,
right.
maybe.
Okay, please go ahead then.
Yeah. Yeah, so rightly with what you mentioned, these elements actually we have found from the field when we were talking to the stakeholders, especially in the Changing the Career Initiative pilot programs on transition in the state of Tamil Nadu and in other parts during the orientations and discussions, that the process of a change at all levels. Especially these elements we have asked the directors of the organization who run the institutional care. So what kind of changes you can actually bring to your organization? So they actually responded what you have told or written here. The change can be at the staff and the caregivers level. They can be further empowered with a new role that supports to family programming. The infrastructure and the facility can be repurposed for any other types of systems or a body which provide family strengthening supports. Let's say a youth development center or family counseling centers. And also, we have actually, when we have presented the idea for transition even to the government authority, so we have also seen their expressions and interest to redirecting the resources, right, to transition the institutional care to build another model like alternative, aftercare supports for youth, young adults, and other things. So these kind of changes is possible, resonating with the theory that you were speaking to. And also improve the community-based family services. That part also we have explored during our discussion with the stakeholders and the planning for the transition, that what kind of a community-based solutions actually the organizations can provide. Those are right now running the institutional cares, right? So in terms of that, also the leadership of the faith groups who actually run the childcare institutions for a longer period, they are also looking at transition models, very tested approach, which also helps them to redirect their resources, which ultimately will result in a reduction in the number of CCIs and the number of children in the institutional care. So it also strongly resonate for the government and the states who are actually planning for the deinstitutionalization, who are planning the state level care reform strategy. So they also can resonate with the transition as an outcome. The number of institutions can be reduced and the number of children in the CCI also can be reduced. Yes, Beth, over to you.
Thank you, Manoranjan. Very helpful. I think it's important to be able to consider the India context here as well. We can go ahead to the next slide. Just want to share briefly some of the core principles of transition. Guessing will be familiar to most of you already. First of all, family care of all types should be prioritized and made accessible. But I want to highlight the end part of this sentence: for all children. We want to make sure that children with disabilities and other special needs, older children, sibling groups, infants and young children are all included when we're talking about and considering transition. The best interest, safety, and well-being of those children should always be at the core of the decisions that we're making and of the activities. Transition ideally means a change in the service model, a change from investment in institutional care to an investment in a different type of service that's needed within the community and that promotes family care. Transition is a process. We're going to see that the phases of that process in just a second. It's not a one-time activity. It requires time and planning, contextualization. It cannot and should not be rushed because children's well-being has to be really at the forefront. Transformation is to be done in conjunction with family strengthening and really developing family-based alternative care. It requires all those components of care reform that I've mentioned, and it's really not deinstitutionalization in isolation. It's a process, and typically evidence is helping us to see that it involves a number of key steps, but that there's also no one size fits all. Every single transition is different. Should reflect the legal and policy framework, the standards of care, child rights, and such should always be at the core. And then we have to really understand that transition is a process that involves many different actors, and that sometimes it can take time to bring all of those actors along. Sometimes transition can take many, many years. It's not something that we can say, okay, we're going to transition, and then in a few months we're ready and finished. Let's go ahead to the next slide. Again, reflecting global evidence and what we've been learning over the last decade or more about transition. This is showing you, and I realize probably some of the writing is small for you to see, but we'll be sharing out global resources where you can read more. We just wanted to highlight that there are different stages or phases of transition based on what we've been learning. The first phase or stage is really about building awareness, using advocacy to make sure that all the different stakeholders have a good understanding of why change and are beginning to have some agreement that they're ready to make a transition. And then the second phase or stage is really around preparation and onboarding. It's where you would see different kinds of assessment and analysis happening. But at the same time, you can see this is not necessarily linear. As you move into phase or stage 2, you're continuing to build awareness and advocate. You might be continuing to bring on other people in terms of getting their agreement. You're really working to align a transition plan with the national government priorities and mandates, and you're building buy-in as you go. We're also want to highlight here that part of preparing is conducting holistic child and family assessments and making sure that we're beginning to prepare for case management and communicating with all different actors, including children and families, to make sure that there's enough time and understanding of the change process. And then phase 3, which has 2 possible outcomes. The first one is really full transition to new kinds of services. And the second option is safe and quality closure with divestment of the resources. And here, let's just highlight that transition is about organizational level processes as much as it is about direct change for children. So you can see there that we've got both organizational level processes in either option under phase 3, but we also have the social work process that will be happening with children and families. So tracing families, doing case management, monitoring children as they begin to move home or back to family, and both organizational and child level processes are equally important. We can go ahead and I think skip the next slide and just go on to the slide. Yeah, exactly. Just for the sake of time. Again, recognizing that people are going to say, I can't read this slide. That's okay. We'll be sharing a lot of materials. It's okay.
Just
it's
if
okay.
I can say, I can zoom it if you want. I can zoom this slide.
Sure, if you'd like to go ahead and zoom. What we wanted to point out here is just that there are different factors that enable, that constrain, and that influence transition. Some of those factors are external. This is an example where maybe you have a government mandate to transition. That's going to thank you. That's going to influence the process. Maybe you have donors who have said, we don't want to support residential care anymore. So you have that kind of external force coming in on the organization. I see that Sandhya is putting some links in the chat so that you can look more closely at this. And then the next layer is really institution level factors that influence risk and readiness. So that's the blue circle. And that's at the individual child care institution level. where you might have thoughts already about how to repurpose, or you might have staff who are really excited about doing something different, or maybe you have a group of families or care leavers who are really influencing the change. And then lastly, at that internal level, you have different factors at the individual level, readiness of families and children to be reconnected, et cetera. So when we're thinking about transition, we have to think about all these different layers of both opportunity, enabling factors, but also the different kinds of things that might constrain or influence, and where resistance might come from. And then we could just go to the final slide. I'm very aware of time here. Right alongside with those different factors of enabling, constraining, and influencing, we also have many different actors that are involved in transition that we need to consider as we're moving through those phases. Right at the center, we have maybe the founder or director, the primary operators of the CCI, and then we have the principal donors. We have within the facility, we'll have the staff. We have young people who have left care but are still connected and very passionate about the CCI and the children who are still there. We have children in care. We have families. We ideally have a social worker. Then on the other side, we have government. You have your government officials who are involved in transition processes. You might have individual donors, or oftentimes churches, faith actors who are very supportive, and then different kinds of donor groups. So when we're thinking about transition, we actually have to consider awareness raising and change processes for all of these different actors. And you can imagine that it would be quite different for a donor, or for the founder or director, especially if that person is outside of India, than it would be for children. So we need to consider all of that, and we need to bring people around us who can help to support those very, very diverse, different kinds of needs. So I don't know if we want to go to a few questions.
Yes, we can take few questions, but yeah, we still have 5 minutes, so we can take few questions.
So I can't see if anybody's hands up, but are there any questions that we're seeing in the chat, or that anyone would like to ask at this point? You can use the raise hand feature.
If anyone has any question, they can either raise their hands and unmute themselves, or you can just put it in the chat box so that we can, the Beth and Manoranjan can take it up. If I may, Beth, there was one question in during the registration. If the people said that if what is the government political will about transition, if there is any thought on that.
Yeah, I want to ping that one to you, Manoranjan. I think that transition or changing, moving away from the reliance on residential care is very much set within, especially Mission Vatsalya. But Manoranjan, what are your thoughts about the current political will in India for this kind of change?
Yeah, thank you, Beth. And also thank you for the question who was asked this. Basically, my thought is transition as the terminology or the concept. It is not actually well defined in the Indian acts for the child protection. Primarily, I'm referring to the Juvenile Justice Act or the National Child Protection Program Mission of Vatsalya or related legislations or policies. But if we see the elements of a transition, right? Because what you are saying, transition is not an activity. It is a process. And for doing the transition to bring the changes at all levels, definitely the prevention, the gatekeeping, the case management, the reintegration, monitoring, family strengthening. So all these are a part of the system that we are doing. Maybe sometimes we are resonating with the deinstitutionalization, right? So in that sense, to do actually transition or to promote the practice of a transition, political will is very inevitable, is very important. So from the experience, we can say at different level, we have to engage with the government systems. At the district level, the district child protection unit and the child welfare committee. I believe there are many honorable members of the child welfare committee are connected over here. So they definitely has to actually, we have to bring the buy-in. We have to establish the common understanding. What do we mean by the transition, right? Because like you said, whether we can go for the safe closure of the institutions or we can go for the full-fledged transition to bring the change at all level. Gatekeeping is inevitable, is essential. And that is something that the Child Welfare Committee and District Child Protection Unit can make ensure and a cooperation towards that. In terms of also providing support, right, whether it is sponsorship, it is other family strengthening provisions for the reintegration of children, so they can do. In that sense, there are many other supports and cooperations are there. If we bring by any of the child protection systems or the head of the child protection systems at the district level, that is from the experience. Second level is at the state level. So if you want to factor the practice of a transition, right? The standards of a transition in the state care reform strategy or the deinstitutional plan, then they are actually, we can engage with the State Child Protection Society, we can engage with the department or the point persons who are actually handling the family-based care or alternative care there, so that we can actually integrate this transition practice and standards. So through these standards operating procedures for integrations or strengthening the family-based cares or strengthening families or facilitating different other schemes to create a new programs that supports family, right?
Mm-hmm.
So when an institution will take a shift and go for creating new programs, so they are actually state party can support. State party can help the district counterparts also to make sure the institutions are needs to be supported to create new programs for the repurpose, for the redirection of resources. It is at the state level or at the national level. So government actually can decide, government can support to redirect the resources to prioritize the family and community-based solutions over to institutional care. So it depends at what level we are engaging. It depends at what level and to what extent we want to factor the transition. But a political will is inevitable for a country like India, where national child protection system is very robust, right, and
Mm-hmm.
well established. So in that sense, we can actually engage at different level, but for sure, to do transition without the involvement of child care system, child protection system, it is not possible. That's
Thank
my
you, Manoranjan.
Thank you, ma'am.
Thank you, Manoranjan.
Thank
And
you.
part of the role that we can play is to build political will and help our government counterparts to understand
Okay.
change.
Thank you, Manoranjan. We can take, I can see Rene has raised her hand. So Rene, can you please unmute yourself and ask your question?
Yeah,
Rene,
hi.
hi.
Hi. Thanks, Manoranjan. Thanks, Beth. It's been really cool listening to you guys talk. So I think what I was thinking, and it's sort of related to what Manoranjan so well, explained just right now. So this bill to transition, I feel like, especially in India, we've been able to get it down into policy, and you see that with Mission Vatsalya. We have enough, I would say, stakeholders who back this idea of transition, also investing in it. We've got, or at least this is how I feel, we've got enough people who wanting to fund this also. The the uh, you know the roadblock or like the bottleneck that I'm seeing is what Manoranjan was also getting at, is that most of the change has to happen at the district level, because that's where your child protection systems are basically nodally located, right? But the resources, the upskilling and all comes from the systems that are outside the district. And I think that's where we are facing a problem, that the systems in the district are just not ready or designed in a way to take on this transition work. Up until now, say we were looking after 100 children in a one children home. Now you will have to go and access their homes at 70 different locations. So even just the systems, the way they are structured, the way the red tapeism in India is, like it's creating the roadblocks majorly at this moment, is what I feel. And I would love to hear, other people who are working alongside me in this field, that is, if that is your experience. And maybe Beth, you could shine some light on, I'm sure this must have happened in other areas too, if there is, any examples or anything we can follow, that how do you bridge this particular gap?
Yeah, I think it's a really important point. A couple of things are coming to my mind. We have to ensure that we're developing the services and that the services are in place before we change the system. And it's why that point that I was making about not just fast removal or change for children, because we need a place for them to land. And so ideally, and I'm always speaking from ideal and recognizing that this is really, really difficult work, but there should be a process in any state in India where the development of community-based services, supports for families, access to your different schemes of social protection, all of those kinds of things are in place alongside of really making sure that the different workforce, even if that's community, child protection volunteers, social workers, others, are really capacitated, not only trained, but they have the resources they need to be able to reach families. We have to be doing prevention of separation and trying to stopgap children entering institutions at the same time that we're trying to shift the institution. So it is a lot, and I think it's why my suggestion would be that, and I think this work is happening, that in each state, there is some work being done to consider to develop a care reform strategy, which looks at all those different parts, and that we're not doing transition or thinking about transition in isolation of all of the other things that need to be happening. I think this is something that's being recognized in a number of other countries, but it's not easy. Having community-based resources available, developing all those parts of the system, including transitioning CCIs is costly. It's often an issue of having enough resources to develop services, and so these are some of the different factors that we'll all continue to work on together. So I hope for now that's a sufficient answer to the question. Please do feel free to continue putting the questions into the chat. What we're going to do now is move to a panel discussion, so we can really hear a little bit more about what's happening specifically in India. And I think this will give some really good context and help us to continue to unpack further. So I want to give a really big and warm welcome to 3 panelists who are going to be speaking with me today. And I hope you can have your video on. There we go. So a big welcome to Preeti Seth, who's from Miracle Foundation in India, and also to Sanjana from Changing the Way We Care India. Great, welcome, I see you there. And then finally to Girish Mentha from Care Leavers Inner Circle Forum. A big welcome. We're so glad that you had time to join us today. Your perspective is really important. So hi panelists, thanks for joining me and thanks for providing the India perspective. You're most welcome. I'm going to start with one question for each of you, and I would just ask that you keep your responses brief, but of course rich with information, so that our audience gets a feel for what's happening in India, but such that all panelists get a chance to respond to a question. So let's see, maybe I can start with you, Preeti. Miracle Foundation works across Madhya Pradesh. Forgive me for my pronunciation if I mess up anything, and also Triki. Can you share what are some of your key strategic elements in your transition work that you're doing that you really consider non-negotiable? So those key things that are just absolutely necessary as you're thinking about transition.
Yeah, sure. Hello, everyone. Thank you, Beth. And I'm really privileged to be part of this discussion on transition, very close to my heart and my work. So thank you for myself being here. I would like to answer this with in three aspects. Just want to first give the organization Miracle Foundation India perspective on transition. What do we understand by transition? What is transition for us? What is the steps and must approach that we had followed as a 6 steps model? And third, what are the key very critical elements that are non-negotiable? Transition is all about holistic and collaborative approach for strengthening communities, ensuring that children are safely reintegrated at the same level, preventing children from getting into the institutions. It has been a very well structured process and time taking that ensures the best outcome for children. So the point that you had mentioned about and Manoranjan also about transitioning and how transitioning it from the lens of child and transitioning from the lens of the childcare institution. So this is how we see when we are transitioning children from the childcare institution to families, it's actually leading to the transformation of the childcare institution to the family-based care. And through this, we have successfully been able to transform 2 childcare institutions, as you said, one in Tamil Nadu and one in Madhya Pradesh. And the key steps that helped us in this journey of transition have been, here I would just request Kavita, if you can show one slide number 4, just for the participants' view while I talk. Thank you, Kavita. The key, it starts actually from the orientation and awareness. Very well said. It's important to see why the transition is needed, what it is, how it is going to impact children. Having a rigorous inspirational dialogues, engagement at all levels. So I give an example when we were working with one of the childcare institutions, it's not at all only about the leaders or it's not only about the board. It's not at all only about what the government. It's actually about all the stakeholders, mapping all the stakeholders, right from staff of the childcare institution, each and every staff, every child, communities, parents, government, mapping out their needs, their fears, because they will have those fears about their identity. They will have the different thoughts, mindset. So it's very important to map out all that and then having a strategic plan in place with the
Very
leaders.
helpful.
That's
Very
something
helpful.
which has been the core step which we had started with that further lead us to understanding the ecosystem, understanding what the national, local context is saying about, like Manoranjan mentioned about the policies. When we were working, of course, the policies, and now with Mission Vatsalya, it's like a very well kind of a political will has increased for sure in India. But this is all about understanding all those perspectives, understanding why the children are in the institution, what is missing in the community, what are the gaps in the community. So we did one exercise that is understanding children demographic that has been very helpful for us to understand the local context of those community from where the children are coming, the reasons for the separation. We also conducted at organization level the strategic review that helped us to understand the assessment at the organization level, like mapping out their resources, their resource mobilization, their staff, because it's important to understand from beginning how the staff roles will get changed into this transition process. The
Great,
staff
thank you. You know,
yeah.
Thank you, Preeti. That's really helpful. I think it brings this alive to hear about your experience in India. Really appreciate it. I'm going to go ahead to the next, only because I want to make sure we have time for all of our great panelists. And I'd actually like to go to Girish next. Sorry for switching up the order, but thank you so much for joining. for joining us, Girish. And I think everybody will agree that it's so important to understand the perspective of young professionals like yourself who have a lived experience of this system and of change. So, as both a practitioner and a director of a Care Leavers Forum, you bring a really unique perspective that I think we can't hear from everyone. And so we'd love for you to share just briefly how your experience is informing your approach to supporting transitions, particularly for children and young people who are leaving care.
Yeah, thank you, Beth, for asking. So, as a practitioner with lived care experience, I think we have our own challenges as a care leaver. Like from every child who is living from childcare institutions, the transition planning is really important part of his or her life. After living from transition planning, why? The transition planning period will play very important role in or his life. Transition does not, if transition did not go very well, it can change a caregiver life or child who living from orphanage or childcare institutions can have their different challenges after leaving from institution. I haven't seen many caregivers in our network have different experience. Some of their organizations supported them very well during their transition planning, but other did not go very well. uh, this made a child go in very wrong direction, and this because any child who's coming into institutional care, many of them have past trauma or situation where he she was away from the family. Even as a full-time care leaver team in the click, we have understood that any child who is left or leaving their family was always missing in their life. And that's why where we build sort of the peer support or kind of the family approach, where we are trying to call every care leavers or any institution children who currently living in the institutions have sort of the brotherhood or sisterhood approach. That's why we kind of sort of the build a guidebook for them, like where we experience our journey when we were in the orphan institutions. What were we are thinking when anyone came outsider in our institution, and how we react. So we just build a sort of a document for children who living in the institution, where we share when you are living from institutions during your transition planning, you need to do this, just prepare for these things so that you can adjust in the society after living from institutions. Otherwise, you will face challenges like we faced after leaving from institution. So these are the few points, and what also three observation we found, like especially working with the care levers, you need to very need patience in very high level. Otherwise, many times care levers or the children, especially the living from institutions, maybe go in the wrong directions. That's why for all the stakeholders like district level child care institutions or CWCs or DCPU, we have to bring all together, because all are the very important component for this transition planning. Otherwise, if we not connected very well, maybe transition can be go in the wrong direction. All we just want to do, bring all together and work together and build a sustainable model for the care levers or alternative cares, and especially for the transitioning planning. Yeah,
Great.
that's all. Thank you.
Yeah. Thank you so much. Incredibly important perspective, and I really appreciate your concrete ideas there about how to best support care leaving for children themselves, and also how to bring in that perspective. We really appreciate you joining us. We have just a couple of minutes left, actually, Sanjana. So welcome to you as well. But I'm going to ask you to be very brief and. For you, I think, and for everyone, Sanjana is from Changing the Way We Care India, working in Tamil Nadu. I'm going to just ask if you can share not some of your biggest learnings, but one your biggest learning, just one, from the work that you've been doing in facilitating transition in Tamil Nadu. So your biggest learning.
Okay, I had 3 or 4 listed, but I would say one of the biggest challenges, maybe I can combine a couple. So, in the past 3 years, we have facilitated the transition of around 130 children who were in CCIs back to their families. And here, one of the major things, assumptions among the social service workforce was that there was heavy investment required from donors to meet basic needs of the child and the family, such as their shelter, the family's livelihood, or the children's education, in order to facilitate this transition. And it was also considered important to ensure that retention of the child and family care, this heavy investment is required. So what we did instead is we trained the workforce's capacity in making use of existing child protection and family welfare systems, especially at the government level. And they are now facilitating these families to access available schemes and services. So what we do is, for example, the sponsorship scheme that is available under the district child protection units is something that we have been able to link several children to, and now it is providing them with monthly monetary support. So this kind of support is much more sustainable than the private funding that they used to look for, and it is also giving them social security for the families. And another big challenge that we had to overcome was the mindset. So the mindset among not just childcare institutions, but also the community and even the families themselves, that institutional care is actually the better option and it is more beneficial for the children. So it took us a lot of effort in terms of, for the community, awareness campaign, reaching out to families and parents through counseling sessions on responsive and responsible parenting, and training community stakeholders on family strengthening and gatekeeping, that have helped us now change this mindset where communities are taking the step to prevent child family separation and gatekeep children from institutionalization. And on the other hand, we are continuously engaging, having dialogues with leaderships and donors of the childcare institutions themselves, and we are sharing our experience of safe reintegration of children and our family strengthening experience with them. And with this sharing, childcare institutions are now coming forward and requesting our support in not just the transition of their children out back to families, but in the transition of their organizations as well. So we
Great.
have other learnings as well, and we are continuously working to adapt our project. So
yeah, that's great. No, it's really, really, really helpful to hear those learnings. I think, again, it's just really bringing it alive for our audience today and kind of what it looks like. And I appreciate that you're mentioning the challenges. We have to recognize that those exist, but that you're also sharing a bit of what's really working to address those challenges. So thank you so much to Preeti, Sanjana, and to Girish for unmuting and sharing a little bit of your experience today. I know it's been fast, so much more to talk about. That's why this is just a part 1 webinar. But now I think we're going to go over to take a few of the audience questions in the last few minutes that we have here. So again, thank you, panelists, and it's been great to hear what's happening in India.
Thank you so much. Thank you, Beth. Thank you, all the panelists, Sanjana, Preeti, and Girish, and Manoranjan ji too, for such an enriching discussion. So now we will be opening the session for open discussion, and I would request Sandhya to please join the discussion and facilitate this open discussion. And for just one request to all the speakers and also to the participants who have the questions, to please keep their questions in brief so that we can address more and more questions. Thank you. Over to you,
Thank you so much.
Sandhya.
Thanks a lot. Such a, enlightening piece of discussion. So now it's time has come for the participants. So I would really request that, you can, unmute yourself. You can raise your hand and then we'll unmute you and then answer those questions. We have some question for you. Because after this panel discussion, I think it is very important to understand your, ideas and experience and, the work which you are doing in your respective states and districts. So anything which anyone would like to answer if you find interesting in the transition of childcare services which you are doing in your state? Anything interesting, positive, or you would like to share? Of course, in some limited words. Anyone would like to share?
You can raise your hands and unmute yourself. So, and please introduce yourself also so that people know
Yeah.
who they are listening to. Anyone wants to go and share?
Anything interesting you would like to share, the experiences, what you have from your state and district? Or maybe the participants from our global network as well? Okay, so we have Mr. Gasir Ram raised hand. Yeah, please go ahead.
Yeah, thank you very much for this opportunity. It was quite a meaningful session. My question may be a little bit, some you may think like somewhere out of the things, but this is what bothering me. When we are talking about children in the institution, and because of a lot of advocacy and all, now many things are being streamlined. The budget allocation to the CCIs is a little bit increased. But in a similar fashion, when children are staying in a residential school supported by government, or in a seasonal hostel, the migrant children are staying for a particular period of time, the costs are not the same. Though children are same and they are having the same kind of requirement so far as food and nutrition all are concerned. But the kind of funding that is made to other institutions are not in a similar fashion. So it is affecting the kind of quality of life of those children. And this other one that recently I had a visit just one day back to a institution which is privately managed, and they are mobilizing their own sources. But I saw that there is a policy gap that as they are staying in the institutions are not being provided with the sponsorship support. But they are not taking any government grant and managed by private institutions are being debarred, I think so, for a better care opportunity. With this present amount of sponsorship support. I think if that can be looked into, that where government is not investing, if they can provide a sponsorship support to those children, they can maintain that institutions well, and the children can get better benefits. So these are two that kind of
Thank you so much.
observation that I've made.
Yeah, thank you so much. Because of the time, of course, we are very mindful about that. I understand that this is one of the challenges you shared. And we have several questions as well for the speakers, and then we are, of course, I will, go to the speakers, but anything which really we want to know after knowing about this discussion on transition, anything in India which you really want to share in this group, in this platform, that, like how do you envision, your organization envision transition? I think I can see some hand raised from
Isaac has raised his hand. Isaac?
Yeah, Isaac, go ahead in limited words. Thank you.
Good evening to you all. My name is Isaac. I am the founder and chief functionary of Cornerstone Diksha, functioning in Tamil Nadu. Actually, we were running a CCI for about 20 years, but we were guided by Miracle Foundation from 2013. And under their guidance and orientation and motivation, we entered into transition of children with safe reintegration from 2019. So by 2024, by May, we were able to reintegrate safely about 166 children into civil districts all the children are spread out in more than 12 civil districts in the entire state. So the guidance and the motivation and orientation given by Miracle Foundation to our entire organization, restructuring the staff, changing of their changing of their roles and responsibilities. We are able to promote all the children, and now they are all doing very well. What helped us reach these successes, the cooperation from the local stakeholders and the support that we received from the local DCPU, CWC officials, and the schemes that we are trying to connect, because families, parents and legal guardians, they face a lot of challenges and they have a lot of needs. And there are social schemes available with the local government as well as from the central government. So our staff, they visit families and they find out their needs and then fulfill with connecting them with the schemes. This is what the motivation for us to children are thriving in their own families. There are some cases we work and parental care and parental guidance, psychosocial support. These are all the helping tools for us to encourage parents and legal guardians to take care of their own children. And we still work with all the families. And there are many children who have successfully completed their studies and they stand on their own legs and they support their own family members, siblings as well. So this is from my side. Thank you for the opportunity.
Thank you so much. Because we have, such a intelligent question from the participants, so I think I would like to take that up. There's one question, Preeti, you have that, in terms of is transformation not more on residential care rather than creating a mindset favoring transition care model? So this is a question to you.
Yeah, sure. I saw that. I though responded, but I would definitely would like to talk briefly. A transformation. It's not only about the residential care, but it's more about the working under the community, developing the alternative care service, and how this shift on dependency of the institution gets lower by working on the attitudinal mindset at the stakeholder. With all the with all the stakeholder. That's all about the transformation of care.
Okay. Okay, great. Another question I have for Sanjana, that how did you manage resistance to change by institutional staff, if any?
Thanks, Sandhya. Sorry. So, thank you for the question. So, one thing that we did is initially, yes, people resisted CCIs. There was this impression that we were trying to close CCIs and they were against us. But continuously working with them, which is also something that we mentioned. From the beginning, we have been continuously engaging with them, having sharing and learning events where we can show our demonstrations, what we have done in the field. How we reintegrate children is not by working directly with the CCIs, but with the families, to do family strengthening and kind of do that demonstration where we show them children can be happy in the families, and then we take forward these learnings and these case studies and show it to them. They actually, over time, they have realized that they are able to open up and accept that yes, institution is not the best choice, even though they are able to provide for all the basic needs such as education or shelter. They're not able to provide long-term life skills to the child, and also the psychosocial status of the child is much more better when they are growing up with their family. So through that continuous engagement and keeping CCIs in the loop when we work on the field, we have been able to see that mindset change. Thank you.
Yes, and I think it is very important that when we say mindset shift, we lot of I think pressure we built on the CCIs. I know that they are the one who is going to take care of this transition process, but I think it is very important when we were talking about the political will that start from the top, and also the in Indian context, I think DCPU, the District Child Protection Unit, CWC, like their mindset shift that children, those who are in institution, children, those who are outside, children, those who are in sponsorship, they are also important, for them to take care. And I think it is happening quite well in India. Thank you so much, Sanjana and Preeti. I have another question for Beth. Uh, um, Oh, before I go to Beth, I think I have a question for Girish. This is something about, aftercare, that what supports are needed. This is a question we received in registration also, that what support are needed for a smoother aftercare, especially in case of children, those who are without parental care and like no parent children. So can you please answer to this question,
Yes.
Girish?
Sure. Yes. So especially for the aftercare, the children who don't have the family or the parents, so they especially first need the mental health support. The psychological support is very required to them, as we also found in our network as well. And the second is most important, financial needs. If like every state have their own aftercare policies and systems, but in reality, very few of them are working groundly. So for the children who living after age of the 18, they required some sort of the financial need support or your financial assistance till the 21 year or 23, so that they can integrate it very well in the society and they can complete their education if they are very good in the education. But due to that, most of them are not able to complete their education due to financial needs, or they do either they do the livelihood or either they do the education levels. So this is my answer, I think. Yeah, thank you. I hope I answer very well.
Yes,
Yeah.
yes, you are. Thank you. Another question I have, Beth, for you, that when we work on transition through family strengthening, the needs and intervention required are diverse, that cannot be planned and executed in typical project mode. In your experience, what may be the appropriate ways of securing the work?
This might be a $1 million question. That's a hard question. I mean, I think it's a great point that we have to be able to invest again in those kinds of services and supports. And I really like that this speaker who's asking this question is pointing out the fact that every child and family is individual, and therefore the needs are quite diverse and different. I think one thing that I would mention from my experience is the importance of investing in different parts of the social service workforce. So training those who are responsible in the community from government, training community child protection volunteers, training your social workers, community social workers, but also social workers from the CCIs, so that people really understand how to identify individual family and child needs, and also understand. I know a little bit about India's system and how complex the different schemes are, to both to access, but even just to understand what the different schemes are that that can be supportive to families. So I think really investing a lot in helping those different actors to understand what resources are available. Just finally, I think what I've seen some initial evidence on the helpfulness of really taking time to, again, make a plan for transition. But part of that is understanding what the costs are going to be, and understanding that there can be some spike costs, some additional costs that are required while transitioning, so that we're supporting the children well who are in care until they can transition out. At the same time that we're needing to spend some of our resources on developing new services, on connecting in different ways to the community, and on a different kind of workforce to be able to support the transition. So I think it is important to make sure that part of our planning is planning for those kinds of costs, and for the training or the engagement of new kinds of staff sometimes. I hope that's at least initially helpful. I know people are really looking for examples, and I think there are some some case studies on the Better Care Network library, probably on IACN library as well. It can be really helpful to read over those case examples, even if they're from other contexts and countries. Thank you.
That
You
is
can
so
share
important.
those resources with the case studies with everyone.
That is so important. I think for everyone to learn about the success and at the same time learn from the failure. So we really need to very much mindful about the case studies, whether it's a national and or global. There's one question, Preeti, is for you, that along with the need to invest in the community-based resources for children and families, there is also the need for execution of effective case management system, which is participatory and keeps the principle of JJ Act at core. Casework is resource intensive and often forms the backbone of the on-ground change. What could be the most sustainable way to significantly improve case management system in India?
Yeah. Thank you. So the very important area of the case management is understanding that case management will happen at any stage. It's like having understanding the key ICP and SIR quality has been the main basis where the investment of more effort in bringing the quality has been there. And also for the social workforce, since they have to deal with a lot of cases, allocation of the appropriate cases, the ratio of the cases child versus social worker, which in our case we have been like 1:25 we have considered can be an ideal ratio for effective case management for one social worker to be able to do it. And last not the least, involving the community, involving the family, involving all the local panchayat there who are in the support of the children in the communities post reintegration and follow up. These have been a very critical areas while working on the case management.
Yeah. And also, I think in addition to that, what I would also say in the sustainability is piece that when we say about the social workforce, so I think to capacity building of the system, like they are going to take up this work. So more focus, effort, and intensive support to be given for the system change, where we are talking about the case management. So if we create that kind of a pool in the state, in the country, I think that is more sustainable rather than doing one by the CSOs. So I think that is something also important. And I think others also experience. We have a Beth, you raise your hand. There's one question, Beth, for you or Manoranjan to respond.
Okay.
It's about how to work with children in terms of an inclusion, that how to work in the transition, especially the children with disabilities. So feel free to answer. Any panelist, I actually referred to Beth or Manoranjan. Yeah.
Thanks. I can just briefly go first, and then it'd be great to hear from others. I'm really glad this question's coming up. I just wanted to highlight the importance of, I think it's really about thinking about all children in transition. And so by all children, that means that we're being inclusive of many different kinds of needs that children might have. We need to put children with disabilities at the forefront. I think that work is so important and can be challenging. We can recognize that there's often a lack of resources and supports for families with children with disabilities in the community. But if we can really put a focus on that, I think it's critical to tackle some of those harder situations and cases first. I think just a couple of really concrete things. I think we can help CCIs to have disability awareness. We can help to do basic disability inclusion training, awareness raising, make sure our case management tools and packages are inclusive, so that they look at questions of disability. They look at each individual child and their functioning and what kinds of supports they might need. So just a couple of ideas about what we can do there. Anyone else want to come behind me with any examples of working with children with disabilities?
Yeah, just I want to add a few points. So what you said, that's important. If we are saying the transition of an institution, caring for children with different needs or different challenges, then of course the transition planning process needs to be disability inclusive, right? So in all aspect of the planning and the preparation, assessment and everything, so needs to be done through the disability lens. That is one. Second is experience working with the children with disabilities. We are working actually with a few children's, having disabled children in the family member, right? So that they are actually we are trying to adjust our case management process so that along with the children, whom primarily we are actually supporting as a vulnerable children in the institution, and their family members, maybe siblings who are actually disabled, so how they can be supported, right? So, but it is depends on in which context you are operating, what kind of services are available there, and the capacity of the families, the social norms, and the flexibility in the community of that family, and also the capacity of the caregivers and the social workers who are managing the case. So there are so many factors, depends on, there is no direct answer, it is possible or it is not possible, but it depends on the context and the factors and the capacities in the ecosystem that we have, how we can integrate those services and the systems and the capacities that can better support a child with the different challenges. Yeah, that is from our experience we are seeing, but it is very difficult. It is not so easy like for other children's.
Yeah, yeah. Great. Thank you so much, Manoranjan and Beth. And Beth already posted one toolkit, with children with disability. So you may find this useful. So please go through the Better Care Network resource library.
Sandhya we are not
Sandhya,
hearing.
we are not able to hear you.
I think she's frozen.
Or
Okay.
Kavita, can you
Yeah,
poll
yeah,
Maybe
here?
somebody else.
I can. There is one question which I want any of the speaker can say this question. So this basically is question from a CWC member. She's written ki we have been talking about transition for CNC, the children in need of care and protection. But do we have any thought or about the children who are in conflict with law? And is there any process for transition for them, or what is their thought? What are we including those children into transition as well or not? It's open to anyone, whoever wants to answer it. I don't know who to choose a
Yeah,
speaker.
I come in here,
Yes,
Kavita,
Preeti.
thanks.
Yeah.
Yeah. So yeah, of course, like when we say children, it's for all children. That should be also for the children in conflict with law in our experience and work. Uh, Capacity building and the sensitiveness, talking about the sensitivity in handling those cases and having that starting from attitude. So we have been bringing the people from the JJB in our training programs, at least those understand the concept of the family based care and how they can line in with the process. The process in the implementation might look a bit different depending on the situational and cases, but this understanding and awareness about that family concept and family based care, how we can meet it from the conflict with children in conflict with law, is also something which gets imbibed through our training with the social workforce, and bringing the convergence element in the place, connecting with all the departments at the district level. Yeah. Anyone else want to add anything? So yeah.
Yeah. Anyone else wants to add anything to this?
No,
Or
what
we move on to
Preeti,
our, yeah, please,
Preeti
Manoranjan.
said, that's correct. Very recently, I was talking actually to a district child protection officer. She is very much interested actually to work with the children conflict in conflict with the law. So what Preeti said, in terms of a process of a transition, it is the same thing. All the elements we have to touch, we have to analyze the context very carefully, very consciously. We have to plan the transition process, and that is needs to be supported with adequate, case management services and other things. But in terms of what Preeti said, the sensitiveness attached to that, so it is better we have adequate extent of knowing and information about the context. So before going, what I was talking and what the officer was telling to me. So before going to the transition plan, I mean the reunification plan or restoration plan with the children with the biological family or any family-based alternative care system. So it is better to do a very specific assessment, right? To actually know the environment, to know the ecosystem, and to know the social norms and the cultures, and also knowing a little more about the source of the things is having in a particular operating context. So that should be done actually before thinking for or planning for a transition of children in conflict with law. Because one of the things of the transition is doing no harm, right? Doing no further harm and minimizing the possibilities of the risk. So that is a non-negotiable standards in the transition process. I understand that from experience. So in respect to that, it is no hurry, it is no worry, it is no haphazard planning or thinking or thought process, but it should be very conscious, right? Informed by assessment, informed by planning, and the capacity and willingness of the stakeholders. It is a very consultative process. Everyone in the
Thank you.
process of a transition should be well informed
Yeah.
before
Thank you,
that.
Manoranjan ji.
Yeah.
Thank you for enlightening. I think I really don't want to close this session. I think there are so many questions and learnings, but we can catch up again in our next webinar. And as Beth has already mentioned, that we will answer all the questions. If we are not able to take up any more questions now here, but we'll definitely mail you or we'll prepare an FAQ and share the questions with you all. So I would now like to call Mr. Prabhat Kumar from UNICEF for a closing remark so that we can move further. May I request Prabhat?
Yes. Can you hear me?
Yes, I can hear you. Can you please switch on your camera also?
I have done that.
All right. All right.
Yeah.
Yeah, got it.
Okay.
Thank you so much. Please.
Thanks so much. So yeah, it's very productive discussion. And like we have been saying, transition is a process. And even this transition rollout that we are making is a process. So it is starting with this webinar, but it would continue, and then there will be subsequent tool development workshops, and then we'll be creating certain master trainers. But just to bring the highlights to key things that we have discussed, I tried to put it how I can do justice in five minutes. So I've put on 9 P's. So just to remind, because then it becomes easy for us to takeaways. One, everyone spoke about the first P, which is process. That transition is a process and it is not an activity. And intentionality there is very important, that we go there with intention, that all the principles that we were discussing, we intentionally apply those principles. The process and strategy should be laid out and then acted upon, not other way around, that we are just trying to do trial and error. Second thing which people, some of you wrote in chat also, is second P, which is about policies. Fortunately, everyone agreed that the policy environment currently through the Juvenile Justice Act or Mission Vatsalya's commitment is already talking about it, about moving from institutional care to family-based alternative care. And we all collectively, like from political will perspective, we all collectively recognize that family care is priority. With that, I'll talk about the third P, which is on the problems. Okay, so whenever we talk about transition, we must keep that we are considering the problems that exist, and we are not creating any problems. So I'll give you example that, and some of you again mentioned that, keep in mind the challenges that are faced by the child protection functionaries when we are planning or the process is being rolled out. And shift should not be on re-victimizing the child. So it should carry, again, to reiterate, 3-4 people mentioned it, do no harm, the best interest determination for child is important. The fourth P that I speak about is participation. How do we involve all the stakeholders and hear them out when we plan, have their say. So it is very critical and important not to leave out anyone. the fifth P is people. The process would require strong people and functionaries, and who are strong, who receive strong training, and there is monitoring support that follows. So we must have people ready from the functionary side who are doing it. The sixth P that I speak about is paisa, which is money, and the policies have to be backed by investment in terms of financial resources. How do we advocate for that and invest both with government or even donor resources are going towards this transition to family-based care. The seventh P is about the preparedness, and Girish very well mentioned example. He also gave example that process of transition impacts the caregiver's life, whole life. So some organization, he told, made efforts when he interacted with caregiver and some did not. So it is important that the preparedness should start at right time so that it has positive impact on child or youth for whole their life. We also must consider, and this is something that people wrote, and I would want to re-emphasize the eighth P, which is about promote prevention, gatekeeping, family strengthening. So transition is not taking place in isolation, but we must remember the other aspects to promote the prevention, gatekeeping, family strengthening. And last but not the least, the ninth P is about the patience. So all of these takes time. Transition requires, and Beth mentioned this in chat and she also spoke, that it requires creating a favorable mindset, changing attitude, and creating awareness for change. And all these require a bit of patience. I feel that we must be mindful about this processes, problems, participation, people, paisa, which is money, preparedness, and promote the prevention, gatekeeping, and family strengthening part. With that, I hand it over to you, Kavita. Thank you.
Thank you. Thank you so much, Prabhatji. I think nobody would have been able to do such a wonderful summarization, and we all will remember the 9 Ps of transition now. So with this, we are moving to the end of the session. And before we end the meeting, I just wanted to make 2 announcements. One is we will be sending a feedback form for you to please give your feedback regarding the content, regarding the format of the webinar. Along with the feedback form, we'll be sending the presentations of the presentation of the webinar and the recording of the webinar. If someone who joined late or maybe have left early, so they can see the presentation. And then next in the series of this whole training program that we have designed on the transition tool, the next webinar is on 16th of July. So we will share the posters and the link for the registration by Monday. And in the second webinar, we will be talking more about the transition tools, unpacking the transition tools. These tools are global transition framework and tools, together the suggestion or adaptation in Indian context. So I will hope everyone who joined today and made this discussion very enriching and very interesting and very fruitful for everyone will join us again on the 16th as well. And with that note, I would request all the speakers and everyone to just open their video so that we can have a group photograph. I think that would be really important. If everyone can just, whoever is present, and if they can just switch on their videos for one. And I'm very happy, even, we're rushing a bit, but we're able to finish it on time. And if anyone, Beth, all the speakers, Beth, Sandhya, Girish, Manoranjan, if you have anything to share, anything which I have forgotten, please do it. I have just only 1 minute and then we'll take a picture and move forward.
Just one thing I want to share, adding to your announcement, Kavitaji.
Yeah.
So basically today we covered the what part of the transition about the concept. But in the next webinar on the 16th July, so we'll be actually approaching how of the transition, right?
Yes.
So what is the framework and what are the tools? So this is very important. So please stay in tune for the next webinar that will really add so many values on your thought process and giving us window actually to approach the transition in India context. Yeah, that's all.
All right. Thank you so much, everyone. Thank you for joining us and making this discussion a very, very enriching experience for all of us. And I really hope we see you again on 16th of July. And we'll be sharing this feedback. Please do give your feedback. It is an anonymous feedback and it is there on the, we'll share the link by tomorrow morning. Thank you, everyone. Thank you so much for joining with us.
Thank you. Thank you, everyone. Thank you, our
everyone.
global
Thank
friends
you.
and also regional friends and our friends from Nepal and Cambodia and other countries in Asia. So thank you, everyone, for making this. Thank you.
Thank